My name is Jocelyn Inverdon, and I'm going to be donning and removing personal protective equipment. So I am standing outside of the patient's room, and I have already performed hand hygiene. I'm going to start first with my shoe covers. So shoe covers do have a right way to be put on, so you want to make sure that you're putting them on the correct way. And then next I'm going to go ahead and put my hairnet on. So super important to make sure all of your hair is tucked in and there's nothing showing. And then next I'm going to start with my gown. So it's super important to make sure that the gown does fall, ensuring it's not touching the floor or any other places. And you're not shaking it out. So some people can tie behind their neck, but I do prefer to tie in front of it and then just go ahead and pull it over my head like that. And then making sure the gown does wrap around the back side of you and tie this one nice and secure as well. So next I'm going to do my mask. There is a right way to put it. You do have a wire up on the top, and that has to, and that goes up on your nose. And you want to make sure that it's nice and shaped to your nose. And you're going to tie the top one first. And then holding this and pulling it under your chin and just tying that last one around your neck nice and tight. And next you're going to go ahead and put on your eye protection. Making sure that your hairnet stays right. And then next is your gloves. So I'm going to go ahead and put my gloves on and ensuring that the cuff of my gown is actually tucked into my gloves, and that just like it's kind of double protection, making sure that that gown doesn't ride up when you are dealing with a patient that is on precautions, like so. And the same for this one, making sure that cuff is in there nice and high up on that glove, so when you do tug, it's not going to come off. So that is donning, and now I'm going to go ahead and remove. So with removing, you're going to start with your gloves. So I'm going to start with my non-dominant hand and grab the cuff of my glove and pulling it inside itself. So you can either throw that away, or I like to just go ahead and wrinkle it up in the other hand. Using my 2 fingers from this, I'm going to fold this other glove into itself as well and throw that right away. Next, I'm going to remove my eyewear, grabbing the earpieces for that. Next, I'm going to start with my gown. So you can untie whatever's more comfortable for you. I always untie the one at my waist, and then I actually just pull off this one. And so starting with the cuffs, because remember they're clean, they're tucked to my gloves, I'm going to pull this one over my left hand, and I'm going to use this one to pull it over my dominant hand. And I'm just going to start folding the gown into itself, ensuring that the part that has been contaminated is folded into itself, and throw that away. And then next I'm going to start with my mask. I'm just going to go ahead and actually pull this off using the ties and throw that right away. Next is going to be my hairnet. Throwing that away. And then last but not least is my shoe covers. So making sure that you're sticking your finger on the inside of there, and I fold it into itself right into the garbage. Same thing for the other shoe cover. Folding it into itself and into the garbage. And that is removing personal protective equipment.